Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon. I'd like to talk to you today about what adenoids are and why they might need to be removed. So most people know adenoids in the context of tonsils and adenoids, but aren't exactly sure what they are on their own. Adenoids, much like tonsils, are lymphoid tissue, but they're in a different location. They sit behind the nose above the roof of the mouth. And so some of the symptoms of big tonsils overlap with the symptoms of big adenoids, but big adenoids also have some distinct symptoms. Often, having a tonsillectomy means you're also having an adenoidectomy, but there are plenty of reasons to have an adenoidectomy without removing the tonsils. So one of these might be mouth breathing and nasal congestion without real sleep apnea. So when a child, or really anyone, goes to sleep, the airway relaxes and the soft palate, that floppy part of the back of the mouth, kind of flops back and hits where the adenoids are. And if there are large adenoids, this can cause obstruction and snoring. Often the kids with large adenoids keep their mouths open during the day. They're often those audible Darth Vader breathers. I usually say they're the kids who can't sneak up on anyone because everyone can hear them coming. Often they can have chronically runny noses. Another reason that adenoids might come out are kids with chronic ear issues. So kids who are on their second or third set of ear tubes for recurrent infections, or kids who are getting to be a bit older, maybe over 4, and are still having trouble with persistent fluid in their ears. The middle ear space drains to the back of the nose via the eustachian tube, and it drains to the area where the adenoids sit. So when adenoids are large and bulky, they sometimes can obstruct that drainage pathway. And so if a child is getting their second set of tubes and they have a lot of snoring or nasal congestion or other symptoms that suggest large adenoids, I'll often address those at the same time as replacing tubes. So there are times that tonsils and adenoids will both come out, things like sleep apnea or chronic tonsillitis and adenoiditis. And there are times that just adenoids will come out alone. So it's important to consider what the clinical picture for a patient is before deciding on any surgery. The recovery for tonsillectomy and adenoidectomy are different, and there are different risks for both. And so we try to do the most minimal surgery that is needed for a patient. Some patients with large adenoids won't even need an adenoidectomy. They might need something like a nasal steroid spray. And if their adenoids are maybe only mild to moderately enlarged, this might be enough to improve symptoms. So the best way to look at a child's adenoids is either with a camera up the nose or with an x-ray. It's not something you can see just looking at a patient, but it's something to keep in mind, especially for kids with chronic nasal congestion or chronic ear issues. Thank you so much for listening. If you want to see more of these videos, please subscribe to Dr. Nicole News.